Hi, my name is Ron Parsons. I'm a midwife and a midwifery educator, and in this series I'll be demonstrating how to carry out a systematic examination of the newborn. The aim of the systematic examination is to screen for congenital abnormalities that might benefit from early intervention and to identify any concerns that require further tests, referrals or treatment. First, I would ensure that informed consent is obtained from the parent or legal guardian. I would clearly explain what the examination involves, its purpose, and reassure them that the process is routine and non-invasive. In line with the Children's Act 1989, consent should be given by someone with parental responsibility, usually the mother or the father if the parents are married. Before beginning the examination, I would ensure I wash my hands. I'll also clean the surface where the baby is being examined and check the room is warm, well lit, and quiet and private as possible. Postnatal wards can be a busy environment, so creating a calm space helps both with the examination and with discussing any sensitive information. Next, I'll gather the necessary equipment, including a stethoscope, a tongue depressor, a light source, an ophthalmoscope, a tape measure, a thermometer, and a towel or blanket to keep the baby warm, and also a clean nappy. I'll ensure that the environment remains warm with the windows closed to maintain a neutral thermal setting throughout the examination. And before examining the baby, I need to review the notes to consider the maternal medical history, including chronic health problems such as diabetes, epilepsy, or medications required during pregnancy, which again could impact the newborn, such as SSRIs. I'll look at the obstetric history, so how many previous pregnancies, and whether there were any issues such as stillbirth, preterm birth, or congenital abnormalities with those children. The pregnancy, including whether it was full term, any antenatal scans indicating issues with fetal growth or infections, or any recorded breech presentation, and the type of delivery need to be considered. I'll look at blood tests, including Rh status, serology, infectious disease screening, and also social history, checking if the mother has support at home, any concerns with housing or mental health, and whether any safeguarding concerns are noted. I'll look at the family history, including genetic disorders, heart conditions, hip problems, or metabolic diseases, and also review the immediate postnatal period, including how the baby has been feeding, whether they've passed urine and meconium, and if there have been any concerns like jaundice or poor feeding. I will also ask the parents to reconfirm the history. Often parents' descriptions or understandings of health conditions may be inaccurate, or they may not think to mention them at booking, so it's important to have a fuller discussion as possible with them. I'll also ask the parents whether there have been any concerns. They will have done the first examination on their baby, and whether there is a family history of congenital heart disease or hip problems.